this tough economic time.
All right, thank you all for coming back. And today we are continuing the workplace health and wellness. And today we're going to be talking about protecting the health of your workforce. And today we have Dr. Kandace McLean, who is a healthy homes specialist with the University of Missouri and also received a Distinguished Service Award from the National Extension Association for Family and Consumer Sciences. And also on the webinar today is Karen Funkenbusch, who is a specialist with Human Development and Family Sciences, who specializes in rural farming. And with that, I will turn it over to Kandace.
Good afternoon, and thank you for joining me today to talk about cleaning and disinfecting, specifically for COVID-19. As you are thinking about reopening or opening your businesses, your facilities, and one of the when you are reopening, proper cleaning and disinfecting is one of the essential daily habits that you need to establish to reduce the exposure of COVID-19. So I think it's important to briefly review some background information to set the stage for why cleaning and disinfecting is so important in fighting COVID-19. First off, there is currently no vaccine to prevent COVID-19. So the most effective way to prevent illness is to avoid being exposed to the virus. COVID-19 is mainly spread from person to person between people who are in close contact with one another, and that's why you're asked to to keep a 6-foot distance. And when an infected person coughs, sneezes, or talks, their respiratory droplets land in the mouths and noses of other people who are nearby. Studies are also indicating that there are many people who are showing no symptoms of the virus and are able to spread it. So that means that they're asymptomatic. So the most effective way to reduce the risk of being exposed to COVID-19 is through social distancing and other key daily habits. And one of those key daily habits is cleaning and disinfecting. Another one is hand washing, or utilizing a 60% alcohol-based hand sanitizer solution when soap and water is unavailable. Avoid touching your eyes, nose, mouth, staying home when you're sick, wearing a mask when you're out in public, and to utilize other personal protective equipment and measures such as gloves if that's needed. So some good hygiene practices, we talked about washing your hands with soap and water for 20 seconds. Immediately removing gloves after contact, washing your hands and immediately removing gloves after contact with a sick person. And if soap and water are unavailable, using that alcohol-based hand sanitizer. So in addition to washing your hands, additional key times to wash your hands include after blowing your nose, coughing, sneezing, using the restroom, before eating or preparing food, after close contact with animals or pets, before and after providing routine care for another person who needs assistance. And these are all good whether you're involved in a pandemic situation like COVID-19 or otherwise, these are good hygiene habits that you should establish in your regular everyday life. Right now, they're asking everyone to wear a cloth face mask cover when they go out in public. Cloth face masks should not be placed on young children under the age of 2. Anyone who has breathing troubles, such as asthma or other respiratory issues, if someone is unconscious, incapacitated, or otherwise unable to remove the mask without their assistance. Okay. The cloth face cover is meant to protect other people in case you are infected. Um, do not use a face mask meant for a healthcare worker. We want to reserve those um, types of masks for people who are really on the front lines. Continuing to keep 6 feet distance between yourself and others if possible. And remembering that a cloth face cover is not a substitute for social distancing. So still trying to maintain, we're asking people to stay home, only to go out if absolutely necessary, because the cloth face mask cover is not a substitute for, just limiting your exposure to keep your distance from people. Okay. So back to cleaning and disinfecting, which is the main focus of our presentation today. Cleaning and disinfecting public spaces, including your workplace, your school, your home, your business, will require you to develop a plan before reopening to have cleaning and disinfecting strategies in place. So we can't send people back to work and school without first thinking through, where are we going to get cleaning supplies? How are we going to clean? Do we have face masks? How are we going to reintegrate our workers and the public back into spaces? And then implementing your plan to take regular action through cleaning and disinfecting to reduce exposure, and plans for maintaining and revising your plan based on updated guidance in current circumstances. I think we all know, I think things are, they're starting to figure some things out now, but for a while, some of the recommendations were literally changing on a day-to-day basis. So making sure that you are, that you're flexible in your recommendation and your guidance as you're reopening. Okay, so knowing the difference between cleaning and disinfecting, it's important to know that routine cleaning with soap and water removes dirt. The disinfectant is what actually kills the germs. So this is a step that people forget about. They want to go straight to the disinfecting, and disinfectants are not nearly as effective if the surface is dirty. So it's important to declutter. So we're removing any unnecessary objects from the surface, removing, visible dirt, crumbs, and then using the disinfectant. So here are some of the steps. So first, minimizing clutter and unnecessary objects that hinder the cleaning process. Minimize or keep piles of papers organized, reduce knickknacks. This will all help simplify and increase the effectiveness of the cleaning process. And again, these are all things that we recommend. I mean, COVID-19 or otherwise, these are the steps that we recommend. And outside of COVID-19, there are a lot of circumstances where cleaning with soap and water, that it might be fine. I don't do a ton of disinfecting on a normal basis, and outside of cold and flu season, I don't do a ton of disinfecting in my own personal home because we just don't have a lot of people that come in and out. But particularly during COVID-19, that disinfecting step is important. But you first need to minimize clutter. Second, clean with soap and water. And third, disinfecting the surface. It is important to make sure that you are disinfecting. If you're buying disinfectants right now, it's important to make sure that you're using an EPA approved disinfectant that works against COVID-19 to kill germs. So a list of EPA approved disinfectants can be found on their website, and there will be a link at the end of this presentation that will take you to a list of EPA approved disinfectants. There will also be an EPA at the store when you purchase disinfectants. There will also be an EPA registration number on the back of the product. So a lot of people are having trouble getting their hands on disinfecting products right now. So if you have to, unexpired, you can make a disinfectant solution at home using unexpired household bleach. So you can use a 1/3 cup of unexpired household bleach added to 1 gallon of water, or 4 teaspoons of bleach per quart of water. A 70% alcohol solution can also be used to disinfect. So only mix the amount that you need. And that's why we give you the 4 teaspoons to 1 quart of water recommendation, because really a bleach solution is only effective for up to 24 hours to disinfect. After that, it's going to lose its effectiveness as a disinfection product. So you may not, there's a good chance that you may not need to make an entire 1 gallon mixture of this and be able to use it all in a 24-hour period. Always making sure that you're storing the mixture that it's labeled, and that you're keeping it out of the reach of children, pets, in a locked storage container, so to prevent a poisoning hazard. Use aerosol disinfectants cautiously. Typically, aerosol disinfectant products are not something that I regularly recommend, because products in aerosol cans can aggravate respiratory diseases such as asthma. However, I'm also taking into consideration the limited availability of disinfectant products at the store, and understand that the only disinfecting product you may be able to get is in an aerosol can. So we don't want to tell people not to use them at all. You just need to use them very cautiously, and to be, if you do have someone with respiratory issues such as asthma or other issues, they probably shouldn't, they should not even be in the room when you're cleaning. Okay, never mix bleach or other really never mix cleaning products together, but particularly never mix bleach and ammonia together, because that creates a toxic gas that can create breathing issues, tightening in the chest, and even death. Do not overuse our stockpile disinfectants and supplies. This is really hard right now, because you go to the store and you want to make sure your family's needs are taken care of, that you've got plenty of disinfecting products. You don't want to run out. However, if we are stockpiling disinfectants and supplies, we're also taking them away from people who may really need them. And I have a friend, this story came to mind yesterday when I was thinking about this presentation. I've got a friend who has cystic fibrosis, and mentioned that this is someone with a serious respiratory issue who really, that if she catches something like COVID-19, it could kill her. And she's having trouble finding hand sanitizer and other disinfecting products. And this is someone who really needs these things for her livelihood. So when we stockpile these things, we're taking them out of circulation for people who critically need them. Also, overusing disinfectants. So more is not always better. And we have to constantly remind people of this. And that's why we that's why we give you the specific recommendations of a 1/3 cup bleach to a gallon of water. More is that is the amount that is effective to kill COVID-19. You don't need to use more bleach than that. And if you do, it can become a serious poisoning hazard. So that's why we really ask you to just stick to the recommendations that are provided. Making sure you're wearing gloves when you're cleaning and other personal protective equipment. Using good ventilation, so opening up a window, running exhaust fans when you are cleaning. When you're cleaning bathrooms, other small rooms, don't close the door, leave the door open. That will provide ventilation. Okay, So if you are overseeing staff in a workplace, which some of you may be, your plan should include considerations about the safety of custodial staff and people carrying out the cleaning and disinfecting process. Now, this is kind of generalized because, you know, there are a variety of businesses and you may have 2 employees, you may have 200 employees. And so if there are specific questions that you have regarding your workforce, the amount of people you serve, whether or not you have a cleaning staff, the specific guidelines you're expected to meet, I would be happy to talk to you on an individual basis. But people, especially people who are carrying out the cleaning and disinfecting process, are at increased risk of being exposed to the virus and to any toxic effects of the cleaning chemicals. So these staff in particular should be wearing appropriate personal protective equipment for cleaning and disinfecting. You know, this could include rubber boots, goggles, masks, gloves. I mean, it just depends on the circumstances and the type of cleaning products that they're using. Okay, so but it is important to protect your staff and ensure that the products are being used effectively. So instructing staff on how to apply the disinfectants according to the label. We can't stress this enough. Make sure that you are reading the instructions on the back of the label of the cleaning product and using it appropriately. Okay, so specifically regarding workplaces, for more information, if you have concerns related to your cleaning staff in particular, you can visit the Occupational Safety and Health Administration's website. They have some specific cleaning recommendations related to COVID-19. So workplace laundry. Now, this may apply to doing laundry in the workplace, or it may apply to someone going to the workplace and then coming home. So a lot of people, especially who are essential workers, are worried right now about going to work all day and then bringing the virus home to their families. So these are good practices. Again, these are good practices whether you're dealing with a pandemic like COVID-19, or even if you have you or yourself or your spouse or someone living in your household is working in an industrial environment, working around chemicals, even if you've been out in the yard spraying weed killer, whatever, the type of contaminant is that you could potentially be bringing back into your household. So my husband works in an industrial environment, and occasionally, depending on what he's been doing that day, he will remove his clothes we have a garage that's attached to the house, and he will remove his clothes in the garage before coming into the house, and then put his clothes directly into the washing machine. What is recommended is that once you undress from those clothes, to place the clothes in a plastic bag and then take the clothes out of the bag and put them directly into the washing machine. So you should always launder the items based on the instructions provided by the manufacturer, because you don't want to do any damage to particular fabrics. However, you should wash those garments on the warmest setting appropriate. That warm water is what is gonna help sanitize that clothing. So some newer washing machines, I have a high efficiency washing machine, and it has a sanitized cycle on it that uses elevated water temperatures, steam, and a longer wash cycle to sanitize clothing. And then after you've sanitized that clothing, wash it on a higher water temperature, making sure that you're drying all of those items completely. When dealing with contaminated laundry, make sure that you are wearing disposable gloves and that you're not shaking the clothing out to spread the contaminant around. And that's why it's a good idea, if you can, to just take the clothes off before you come in the house and place them in a bag. And then cleaning and disinfecting clothes hampers, personal clothes hampers frequently. So if you have a plastic clothes hamper, you can use a disinfecting wipe to wipe those plastic clothes hampers down. If you have a fabric hamper, it's a good idea to get a liner for it. And my son's hamper has a fabric liner in it. I just take that liner out and I throw it in the washing machine to wash it once in a while. Okay, so developing your plan. We talked about making sure that your plan is flexible and includes a long-term strategy for cleaning and disinfecting. So something to consider is, and this is I've done this presentation a couple of times, and this is a newer recommendation from the CDC that, to think about whether your area has been unoccupied the last 7 days. So, there are some businesses that have been closed down for 2 months or more. If there has not been anyone in your building in a week, you can just proceed with normal routine cleaning to reopen your area, to reopen your facility. Now, once people have been in there, you're going to need to proceed with the disinfection process, the enhanced disinfection process. Now, some questions that have come up to me are, well, we've been closed for over a week, but how do we know that someone hasn't really been in the building? So maybe someone has access to the building and they came in and grabbed some supplies or worked on their computer or, used the bathroom. So, this is just going to be very dependent on the type of business that you have, and every business is going to be different. So you're just going to have to assess your own individual needs. So consider items that can be moved or removed to reduce frequent handling or contact in your facility. So someone told me that they went to vote recently, and there were touch screens to enter your vote, and they gave people Q-tips to touch on the touch screen, and then you just threw the Q-tip away when you were finished. And I thought that was a great way. That was great because you are reducing the number of people who are using their finger to touch the touch screen and then potentially passing the virus on to someone else. But in your lobbies, thinking about soft and porous materials that might not be able to be washed or disinfected easily. So can you remove rugs? Is there seating that you can eliminate for a while that can be removed or reduced? Getting rid of things like candy bowls, ink pens. I've seen some places that have one basket for clean pens, one basket for used pens, so that people aren't rehandling the same ink pens. I also talked to someone who said, we can buy thousands of pens in bulk. We'd be happy for someone to just use one and take it with them. Those are all things that you're going to have to think through. Public coffee makers, some places have the Keurig. I shouldn't use brand names, but let's just say single-use coffee makers where people can make individual cups of coffee and tea. Those are the kind of things you may want to do away with for a while. Magazines and lobbies, things that people are going to be frequently touching and rehandling. Okay. Something that's very important to think about when reopening, do you have enough cleaning and disinfecting products and supplies? So can you get your hands on EPA registered disinfectants? Can you get your hands on enough masks? Can you get your hands on paper towels, rags, disposable gloves, toilet paper? All of those things are going to be important in reopening, staying open, effectively disinfecting your facility. So thinking through what needs to be cleaned and how often. So you may, and who's going to do the cleaning? Some people may have a cleaning crew or a janitorial service that comes in. Some people might say, okay, I'm the business owner. I've got 2 employees. I'm going to be the one doing all the cleaning. You know, it's just going to depend. What surfaces will just require cleaning with soap and water? Which ones are going to require frequent disinfection? So things that are going to require frequent disinfection are what we call high touch surfaces. So light switches, door handles. If you have a front counter, maybe where people are leaning against it, all of those things that are going to be touched often. High touch surfaces might be electronic devices, if it's phones, computers, computer mouses, computer keyboards. Okay, what surfaces need to be so there are some things that just need to be disinfected daily, and that might be countertop surfaces and things like that. And then there are things that will need to be disinfected after every use. So if you do have keypads, touch pads, those kind of things, they need to be disinfected after every use. Or as I had suggested, some people are using, maybe you get a box of Q-tips and ask people to use Q-tips to touch the touch screen or keypad and then throw them in the trash. So outdoor areas generally just require normal routine cleaning and do not need to be disinfected. So you might want to consider methods to reduce the contact of frequently touched surfaces. So as it gets warmer, there are some outdoor surfaces, such as the entrance to door handles into your facility. Okay, that would be an outdoor surface that probably needs to be disinfected regularly. However, as it's getting warmer, are there methods that you can use to reduce touching those surfaces? So can you prop a door open? You know, that might be harder as it gets hot and humid, but it may also reduce contact with touching the door handles. So those are all things that you're going to have to think about. Can people enter and exit through different doors to reduce contact? But in most cases, outdoor surfaces, if you've got benches, playground equipment, things like that, routine cleaning is going to be sufficient. Again, we want you to focus your energy on disinfecting those frequently touched surfaces. And so toilets, faucets, we talked about frequently touched surfaces, but door handles, countertops, light switches, tables, toilets, faucets, sinks, remote controls, touch screens, those are all frequently touched surfaces. Okay, so electronic devices. So we all rely on electronics for our personal and professional lives. So make sure you're cleaning and disinfecting your electronics regularly. You may be able to get wipeable covers for your electronics, making sure that you're following the manufacturer's instructions for cleaning and disinfecting. If there is no recommendation for cleaning and disinfecting your phone, your tablet, your remotes, those kind of things, you can use a 70% alcohol wipe or alcohol sprayed onto a microfiber cloth. So the important thing here is to note that you don't ever want to spray the alcohol solution directly onto the electronic device. always spray it onto the microfiber cloth and then use the microfiber cloth to clean the electronic device. And in general, avoid sharing electronics right now. If you do share items, make sure you're cleaning them before and after sharing. Okay, so some things to consider as you're reopening. Some of you may already be open, but coronavirus, you know, we kind of said that if your facility hasn't been open in 7 days, you can proceed with regular cleaning. Coronavirus will naturally die on surfaces within hours to days, and that's why the CDC is now making that recommendation that you can proceed with routine cleaning if your facility has not been occupied for 7 days. Okay, so depending on when your space was last occupied is going to determine the amount and extent of cleaning needed. So making sure that you're opening outside doors and windows and using ventilating fans to increase air circulation when you are cleaning. But always be aware of those who may have allergies or asthma when windows are open to the outside, or if the air quality is poor. You know, ventilation is just a good way to kind of air out the space too, especially if your office hasn't been open for a while. Okay, so, you know, just making sure that you are implementing routine cleaning while open, who's going to be responsible for certain cleaning activities. These are things we talked about: cleaning visibly dirty surfaces with soap and water before disinfecting. Making sure that you're using an appropriate cleaning and disinfecting product for the surface or object. Okay, so just making sure that you're following the product labels. Some product labels recommend keeping the surface wet for a specified amount of time in order to be effective. Making sure you're keeping disinfectants out of the reach of children, pets, those who may have impaired judgment, such as individuals with dementia. Okay, so maintaining and revising your plan. We know that routine cleaning and disinfecting are an important part of reducing the risk of COVID-19, and that routine cleaning with soap and water will reduce exposure risk and is necessary before disinfecting. Okay, and this is just a little bit of a review. So making sure that high-touch surfaces are disinfected at least daily. And remembering that some things will need to be disinfected after every use. So public keypads, shopping carts, those kind of things. Remembering that reducing exposure to yourself and others is a shared responsibility. So this is something that we all have to be accountable for right now. This is something that we all have to be diligent in our efforts about. Okay. And here are some additional recommendations from the CDC about reopening and, you know, reopening guidance and cleaning and disinfecting public spaces, workplaces, schools, and homes. They also have recommendations for healthcare, other community locations such as schools and daycares. They have very specific recommendations for just about any facility that you could think of. So colleges and universities, daycares, faith-based organizations, businesses, law enforcement, retirement homes, homeless shelters, correctional facilities, even transportation services like ships, airplanes, buses, trains, taxis, bars, and restaurants. So if there is information that you need, it is out there. Okay. So I am going to turn it over to Karen, who is going to talk about some other resources.
Thank you, Kandace. We know that cleaning and sanitizing your workplace is important. During these unusual times, employers are faced with having some very difficult and maybe even painful discussions with their employees. Hey, Kandace, can you turn it to the next slide? As an employer, while cleaning and sanitizing the workplace with employees offers a great opportunity to listen firsthand to your employees' share stressors that they are experiencing in their daily lives. However, 68% of employees report that they are worried about having these discussions with their employers in fear that it could impact their job security. As an employer, there are 3 cost-effective ways to address mental health issues in the workplace. As an employer, you can have an open, transparent discussion at all levels in the workplace. As an employer, you also can become educated about mental health resources and social services that are available not only in Missouri, but also at the national level. Lastly, as an employer, you can ask for help or guidance when needed. As an MU Extension Specialist, I have heard how our businesses, employees, and families are feeling overwhelmed by the emotional, mental, and financial stressors caused by our current state and national circumstances. So today, I will briefly discuss mental health resources and support services that an employer can share with employees to help reduce and lower workplace stresses. Next slide. So let's talk about stress. Not all stress is bad. A little bit of stress can help us stay focused, energetic, and able to meet our new challenges in the workplace. It's what keeps us on our toes while cleaning and sanitizing our workplaces or alert to prevent accidents or costly mistakes. Short-lived feelings of stress on a regular basis and a part of our life. The physical effects of stress usually do not last long. However, some people find themselves in a nearly constant state of heightened alertness. This is called chronic stress. If stress becomes chronic, it can adversely affect our physical well-being, thoughts, and actions. This will be discussed in the next webinar. Next slide. So what can be done? Let's talk about some of those mental health resources and support services that community leaders and employers can provide to their employees. What I'm going to talk about and stress the most are the MU Extension evidence-based mental health and stress management 1-hour or 6-hour classes that we offer to the working adults and youth, including our rural farm families. Here are some classes to take into consideration. The first class that I want to talk about is called Taking Care of You. Taking Care of You is broken down into 4 2-hour sessions or 1 8-hour sessions. It's a multi-session program offering practical strategies and experiences to help an individual deal with stress in their life. Each week, participants explore a different topic through small group discussions, self-reflection, and activities. Activities of the program are aimed at increasing mindfulness, positive emotions, optimism, resiliency, distress, coping skills, self-care of body, mind, and spirit. The next thing I want to talk about is also a 1-hour course. It's called QPR. A QPR stands for Question, Persuade, and Refer. The 3 simple steps anyone can learn to help save a life from suicide. Just as people get trained in CPR to help save thousands of lives each year, people get trained in QPR, learn how to recognize the warning signs of suicide crisis, and help to question, persuade, and refer someone to help. If an employer is looking for a more in-depth class, we offer mental health first aid. This is a 6-hour class, and it's a skills-based training course that teaches participants about mental health and substance use issues. Mental health first aid for adults is offered face-to-face and online, while youth mental health is only offered face-to-face. The next thing that I want to mention are 2 free resources that the University of Missouri Extension offers. The first one anyone can access. It offers free downloadable stress and wellness resources. This is located in our mental health toolbox. The toolbox is located at the Show Me Strong Farm Families Facebook. And on this Facebook, you can see resources that you can download that's anywhere from stress to anxiety, has fact sheets, it has guide sheets, it has infographics, it has videos, and it has webinars. The other thing that I want to stress is that MU Extension also offers a COVID-19 website that is Help is out there if you would need it. Help is there, and it's a phone call away. Help is available for both employers and employees. The 1-800 hotlines are available, and they're at no cost. Employers can give these to not only their employers, but employees and other community leaders. These hotlines offer 24-hour confidential help, and they're free. As an employer, by providing the 1-800 hotline provides an opportunity to give you some comfort in knowing that at the end of the day, your employees are safely returning home to their families and their loved ones. Next slide. As an employer, you can address and reduce mental health issues in the workplace by learning the warning signs of stress, communicating to employees about their workplace stresses, educating employees about mental health programs, online resources, and social service agencies that are available, and mostly asking for guidance and help when needed. Thank you.
Thank you for joining us today, Karen and I, to talk about workplace wellness. And we appreciate you have Karen and I's contact information. So please feel free to contact us with any further questions.
I have a quick question. I'll start with Karen. What do you think is some of the biggest obstacles when it comes to people actually talking to others about mental health? Because it can be a scary topic.
I think the biggest obstacle that people have about talking about mental health is the stigma that is attached to it. We live in a society where we're supposed to be strong, we're supposed to have be all knowing and all knowledgeable. But I think sometimes it's very difficult to have these conversations when we're afraid of what people are going to think and feel about us after we start expressing our own mental health concerns that we may our own mental health concerns that we have.
And sometimes with these, it's easy to sometimes maybe pass along these phone calls. Is there some type of advice you would give if you do refer somebody to like one of the hotlines, Karen?
Yeah, the hotlines is a handy resource that as an employer, they're free. And so this is a great way for you to get comfort in knowing that you are helping your employees get the needed help and guidance that they may need. It also provides an opportunity for you as a check and balance to make sure that you've done the right thing, because it's scary, John. It's scary knowing that you have a worker that's at risk, or you have a worker that is at need, and you're not sure what to do, and you're not sure if you handled it very well at all. So those hotlines also provide an opportunity as an employer to make the call and go over the action steps that you just took with your employee to make sure that at the end of the day that employee will go home safely to their family. And again, I think that gives great comforts to an employer knowing that they potentially have saved a life.
So kind of switching roles a little bit here, Kandace. How does an employer reassure that their employees are working in a safe, disinfected environment?
Well, I think the first step is, working directly with your employers to show them that they have a plan. Employees don't want to come back and think that there's absolutely no plan in place for keeping them safe. And so I think, discussing with them,